Hey guys, Don here. Welcome to Podiatry Practice Mastery. I'm going to go over the $1 Million Minute. I want to share a little bit what's going on with us in the office. So I didn't record my last Friday, only because I was only there a half day. So the first Friday of each month, we only have a half day because the staff has staff training. It's a time that they use to go over things in the office. So we just have it set in stone. It was mostly just routine patients. I had 4 that were on my nail tech schedule, and she's been really helping me out. I think it's been a couple months now, maybe 3 months, and she's able to do all the toenails now. So the next step will be, on certain patients to teach her to debride the calluses. And so I'm just kind of have to teach her that. That's kind of the next step. In practice, we are kind of preparing our protocols for going to ModMed. I've talked to a couple of other doctors. I'm not looking forward to the transition. I think it'll be good in the long run, but it's going to be a painful thing because I remember when we moved to Athena, all patients were new patients. So we're kind of getting ready for that. We're getting our some of the protocols ready, but a lot of it's hard. You can't really do it until you have the patients to do it with. But anyway, I'll let you know about the whole process. So I may stop doing these or kind of diminish these $1 Million Minute things as I get too crazy with these other things. Okay, I'm getting a little burnt out of doing all these daily little blurbs here. Okay, so let's go into it. This was a Monday I'm recording for in the office. 22 patients, no openings. First patient was a Lamisil booster. Next patient was a CaryFlex, a patient that was concerned that her CaryFlex was detached, but it really wasn't. I find she only had a little place at the base of the nail that was attached, and so the whole thing is going to be lytic or detached a little bit, but she was fine. So that was kind of my least valuable patient because that was like a level 2 visit, because I didn't even do anything for her. Next patient was a new patient that came in for a wart. Did an x-ray because he had foot pain, did an Aldera prescription, and I did Cantharidin on him. Next patient was a ulcer patient. This was a patient a few years ago. She had an ulcer and ended up having an amputation of the 4th toe. Now she has an ulcer, or she had one I've been treating on the first med head, and it just came in, just cellulitic going up her leg, so she had to be admitted for an IND. So those are always hard patients, because especially they have to wait in the ED to get admitted. Next patient was EPAT. She was here after 3 EPATs, and so based on the ultrasound, we decided to do another round. So I did number 4 today, and then she's going to set up 5 and 6 for her heel pain. She was finding some improvement, but it wasn't totally up there. Next patient was a fungal nail patient, so they did fungal nail number 1, which is the kit and UV light and shoe spray and things like that. Next patient was this is a patient that came in. I don't know how he got his routine patient on my schedule, but he came in a stretcher from a facility, so I think we gave an exception to seeing a routine patient on a non-routine day. Next patient was the fungal nail number 1 protocol. Next patient was another patient that didn't show up, so there was a no-show. Next one was number 5 out of 6 for EPAT. He's doing better. Next patient was a patient. She had an MIS Taylor's bunionectomy with an osteotomy that slightly corrected it, so it moved it medially and proximally. And there wasn't much bone-on-bone connection, and it slightly dorsally elevated, almost like an elevational osteotomy. So it kind of moved it medially, dorsally, and proximally. And because of that, it's been 4 months, and there's really not much bone healing. And so this was done by another doctor. I think she was really pleased with this doctor in New York. And but it didn't turn out well after 4 months, and so she came in for focus shockwave. So we're going to do 6 sessions. She's a competitive skier, water skier. And so we're going to be doing that. So she's going to still try to water ski. It's not that painful, but it's really painful with the focus shockwave. And so for that, I had to get up to 0.3 or 0.35 to get to the bone penetration. So she's going to set up those around her water skiing schedule. Next patient was an ulcer. This is an ulcer, one of these chronic ones on the 5th toe. No bone infection, got an x-ray, and it's just slow to heal. Next patient was a patient with, they did an x-ray, did an ultrasound, and she had some heel pain. So she did some just normal plantar fascia treatments, icing, anti-inflammatories, night splint, and we talked about doing shockwave, but she didn't want to do that. So she's going to try some of these other things first. Next patient, similarly, these are old. This one's an 81-year-old. This is another 78-year-old patient. She's had pain as well. So we did a night splint for her and the morning stretch, and we're going to see how she's doing after that. We did an ultrasound to show the thickness for both of those last ones. Next patient was a CaryFlex that I put on the toenail for this patient. Next patient was EPAT number 4 out of 6. She's starting to get better. Next patient was a Cantharidin with Aldera. Next patient was a EPAT number 3 out of 6 for heel pain. Another missed appointment. And then a new patient that had some anterior shin splints and as well some ankle pain. So we did x-ray and we gave her some foam rolling. This is a 15-year-old kind of a gymnast. And the last 2 were shockwaves. They were number 3 out of 6. So a lot of shockwave. That's what I have in that Westboro office. But everything else went well. We're kind of getting, like I mentioned, kind of focused on the ModMed transition. And I'm going to be going today to something called Strategic Coach. I have been going there for a long time, so this is kind of where I go to get coached, and I'll tell you more about it when I get back. I go there every 3 months, and we kind of work on the practice, kind of what's working, what's not working, and that's where I get kind of a lot of the fodder for my ideas here. But once again, thank you guys for listening. Hope you find it beneficial. Once again, if anyone wants any help, just reach out to me. There's a lot of ways I can help your practice if you want help. Okay, thanks.